Welcome to Notepad. I'm your host, Ibrahim Sani. On the eve of International Women's Day, we try to celebrate the efforts on improving the issues relating to women. And of course, we're talking about not just about the socioeconomic impact of how women bring to society, but of course, the idea of talking about the health and well-being of women outright as well. Joining us are folks from the Garland Center. We have the co-founder or the founder of Ova, as well as the editor-in-chief of CodeBlue, Boo Su-Lyn, who is also a friend of this station. And joining us and making her first TV appearance is Najua. Of course, she is part and parcel of how Ova is being run. Ova is, of course, the key publication when it comes to women's health to be coming out from Garland Center, the freshest and the newest publication out there. Maybe we can start with Su-Lyn. Let's do a quick recap into how CodeBlue is approaching International Women's Day and why you guys are launching Ova.
Hi, Ibrahim. Thanks for having us on the show. So I started Ova because I just got tired of seeing women's health issues relegated to the lifestyle section in the middle of the newspaper somewhere. And with CodeBlue, so even though CodeBlue reports on healthcare issues only, but then even within healthcare, we can't cover everything related to healthcare. And that includes women's health. So we started Ova because we wanted to highlight specifically not just women's health, but also socio-political issues related to women. So with that, that gives us, so having a separate site enables us to hone in even deeper on women's issues and make them as mainstream as national politics.
Najua Ismail is the Ova Assistant News Editor. Najua, basically you run the day-to-day publication of it, and what moves the needle when it comes to talking about women's issues on Ova?
Okay, there's a whole lot of issues when you talk about women's issues. It runs the gamut, and of course, what we choose to publish also depends on the timeliness. Like for example, at the moment, the sexual harassment bill is being tabled in Parliament, so we covered that, and then after the pandemic, the pandemic for the last 2 years has been a trending topic and has sort of overwhelmed all other women's health issues. So now 2 years after intense period of lockdown, after the pandemic, we feel it is timely to cover other issues that have been relegated to the sidelines during the pandemic. So a lot of it also is, it's strange to say that the topics are trending or timely, because I like to think all these issues are, all these issues are ongoing, that we constantly need to discuss them and address them. But yeah, there are certain things that, that ties to events that are happening now, whether they're being tabled in Parliament or whether it's about time we bring attention to other issues, other women's health issues after the pandemic. So these are things that we look at when we when we decide what we want to put on the website on a daily basis, on a regular basis.
Add on to what Najwa said also. So CodeBlue has run plenty of stories about the COVID vaccination program, and we try to combat misinformation. But the lack of specific views on COVID vaccination among certain patient groups and among women have actually affected the program. So Najwa recently interviewed an oncologist who revealed that there were actually some breast cancer patients who stopped taking this drug, tamoxifen, that helps prevent and treat breast cancer because they were afraid on how it would interact with the COVID vaccine. And in fact, some women also delayed getting their breast cancer surgery because, again, they were afraid of how it would interact with the vaccine. So that is actually very crucial. And had we known about this earlier, and we could have published stories and reports on the fears that these women have, and then the Ministry of Health could then address these concerns and let women know that it's okay to continue taking their medicine for cancer, and they should not absolutely should not delay their surgery. So we got Ova got the Ministry of Health to give us a statement saying that it's fine. You can continue taking tamoxifen while getting vaccinated. I mean, at this stage, it's just going to be the booster program. So the lack of unique perspectives on how things affect women really does play a crucial role, and it should be highlighted so that women in this case can continue with their treatment and get vaccinated at the same time.
That's a very timely point to raise up, Su-Lyn, because if you check COVID right now, there's over 33,000 deaths when it comes to COVID. One of them is actually a dear friend of mine from school. She is or was expecting, and therefore she basically took the initiative of not taking the vaccine while she was expecting. She perished based on because of COVID. And I feel that death could have been prevented if more information was made known to her at that point in time. And that kind of news really reverberated across us, because it's a friend. We grew up together, we went to school together, and we don't want issues like this to be repeated. Therefore, the information flow must be given not only on a timely basis, but as easy as possible for everyone to get. Maybe Najua, you can touch on how Ova is trying to reach to all the markets that you guys are targeting. Do you feel that making things, not just in-depth analysis and report-based, but of course try to make it as social as possible is key in ensuring that the information that you guys are propagating actually reach to your target audience?
For sure. I think there's a lot of nuance missing in coverage of women's issues in general. For example, like there's a lot of articles about breast cancer, and a lot of it, emphasizes lifestyle choices, the need to conduct regular self-examination, for example, and that is indeed important. But for example, like I was diagnosed with breast cancer, and when I went for the screening, I was told that I would not have been able to discover I wouldn't have been able to find out through self-examination. Basically, it would have to be done through screening. And also, for example, after I told people that I was diagnosed with breast cancer, I got a lot of questions about, am I eating healthy? Do I exercise regularly? And so to the point that it got offensive, because it started to sound like the cancer was my fault, that I did not take care of my body well enough. And I'm not the only one to have expressed this, because when I was undergoing radiotherapy, there are other patients there who were waiting to go to radiotherapy with me. We talked about this. So there is a lot of dimension to these women's health issues, not just breast cancer, many of these issues. And so that is something, because we're very new, that I certainly want to think about in how we present this information to the general public. Because, like, for example, also, I remember seeing an ad that says, like, 1 in 10 women get breast cancer, don't be the one. So again, that was very jarring. So I think a lot of information is presented that way, presented in a very provocative manner, without consideration about how its message is received by the people who need it. So those are things that definitely I would like to think about moving forward with Ova. Yeah.
Su-Lyn, CodeBlue came about during the pandemic, and you covered a lot, not just about the vaccination per se, but how health news is being covered. I surely, personally, on personal level, on individual level, rely on CodeBlue most of the time, because it's contextualized towards the local norms and local requirements. I do feel that CodeBlue has that nuance in moving the messaging across, using the necessary languages, trying to make us understand the vocabulary that is being used both by the health professionals as well as how you can normalize those terms and phrases and context onto the everyday user, people like me who are not in the medical fraternity. Do you feel that that kind of nuance can be carried forward from CodeBlue through Ova via the Garland Center apparatus?
Actually, Ibrahim, CodeBlue was set up in 2019 before the COVID pandemic. And the Ministry of Health was already looking at our reports and then taking the appropriate action for better policies after reading some of our stories. So this happened even before COVID. But of course, during the pandemic, CodeBlue became a lot more popular and a lot of people were using our stories and our analysis to help them understand what was going on. And yeah, you just hit the nail on the head. What we plan to do with Ova is exactly like how we plan to do with CodeBlue, which is to make women's health issues more prominent so that the government policymakers can read about women's experiences, the problems that women have with accessing just basic healthcare services. Even simple things like pap smears, oral contraceptives. Those are things that are still not available to unmarried women in a lot of government health clinics. So we want to raise this issue so that the government will pay attention to them and take the appropriate policy measures to improve women's access to healthcare services. And so with this platform, we can have resources on a lot of different women's health issues. As Najwa said, there's not a lot of information about women's health in Malaysia. You can get it overseas, but here there's a lack. So that's how we came about with Ova, to fill that gap, that information gap, because it is with information and knowledge that people are empowered to understand what's going on and to demand for better policy measures from the government or even in the private sector too.
Still on messaging and still on how to communicate the messages across. Najwa, what you mentioned just now, based on your experience, it does come across as people being clustered into three broad groups, I suppose. The first is, of course, offensive, and they are rather malicious in terms of how they want to blame or guilt a person into thinking that the disease is because of the person's lifestyle or actions. The second is perhaps based on ignorance with no malicious intent, but still can come across as abrasive. And the third completely is unaware of how to approach the situation. They don't know what language to use, how to console. That kind of awkwardness comes about. But all three needs to be addressed with, as you would put it, greater nuance. How would Ova and CodeBlue, and for that matter, Garland Center, approach this in a way where you're trying to address all three groups separately, but at the same time, ensuring that the market or the audience actually gets educated along the way without being too condescending or without being too abrasive?
Okay. Well, I'm strictly working on Ova now. Again, because we're in the very early stages of Ova. So, and for me, that part came from personal experience. And I would also like to emphasize, like you said, that a lot of it, was probably not said with any ill intention or malice. I got that from family members and friends. I think a lot of times people don't know what to say and they want to feel like they're saying something useful. So that comes out. But yeah, that is a very, so these are things that we have to be mindful of where Ova is concerned. And because we're very new, so, I don't have a lot of details about how because the site is still expanding based on what comes up, the news today, what the latest developments are. But certainly, and while we do have guidelines for the site in terms of language, I think we haven't perhaps have sort of a more cohesive philosophy about how we are going to, or a more concrete philosophy about how we are going to address these issues in the content that we put up on the site. but certainly, I mean, like those are things that I would take into account. But then there's also, like I said, this is, I'm speaking from just the OVA point of view. So there's also Gallon Center and Code Blue, and so because I suppose we're under one umbrella with Gallon Center, it would make sense to sort of standardize how we would approach reporting, writing, and putting the content, this type of content on our sites, because, like you said, it's very nuanced, and the language that you have to take into account, and the target audience as well. So yeah, those are things that moving forward probably we would uh, look into,
Yeah.
yeah, standardizing and firming up, so to speak. Yeah.
So basically, we are guided by the human rights framework. So all of our reporting, both at CodeBlue and OVA, we are always guided by human rights principles. I mean, if you recall, during the COVID pandemic, a lot of doctors and even human rights groups did not oppose the very oppressive measures that were taken to combat COVID infection that actually turned out to be completely useless anyway. But we raised, so at CodeBlue and Galen, we raised the fact that, things like weeks upon weeks of MCO lockdowns on which disproportionately affected poor communities to the point that some of them were starving, that is completely antithetical to human rights. So everything we do is guided by the human rights framework. So in cases like, for example, with Najua's experience, we could have letters to the editor. We could even do news reports on OVA explaining this is what breast cancer patients feel when you tell them stupid things like, did you eat well? Did you exercise? Because people may not know, right? As you said, they may be ignorant. But then when you tell them, when we have stories that say, oh, I actually felt offended when people said things like that, and then people understand, and we can also talk to oncologists and ask them, what is the typical risk for breast cancer. And as Najua's experience said, even regular self-breast exams, right, Najua, you wouldn't have been able to detect your cancer. So those are the kind of things that actually I didn't even know until Najua told me. So we can report this, and then people understand the issue better.
All right. We'll go for one short break before we continue our conversation with CodeBlue as well as OVA. We'll be right back after these messages. Thanks for staying on with us. We are celebrating International Women's Day 2022 with the theme of Break the Bias. Joining us on the line is Najua Ismail, the Ova Assistant News Editor, as well as Boo Su-Lyn, the Ova Founder and Editor-in-chief of CodeBlue. Su-Lyn, maybe you can pick this one up. How do you set the editorial direction for Ova and in ensuring that you guys continue to make women health issues a little bit more prominent for this year? How does this tie up with this year's IWD's theme of Break the Bias?
So at OVA, we want to do a lot of things. So we've highlighted already from Najua's reporting some stories and reports about how the COVID pandemic disproportionately affected women, something that was very lacking in mainstream media coverage of the pandemic in the past 2 years. And the other issues that we want to highlight, as COVID becomes endemic, and then the government policymakers can start to refocus their attention on issues that were long ignored during the pandemic. So, for instance, sexual and reproductive health, women's lack of access to birth control pills, pap smears, abortion. We want to report on female genital mutilation, the husband stitch, things like bilateral tubal litigation. You need to, married women need their husband's consent to tie their tubes, which is completely ridiculous, because what a woman wants to do with her own body is her own and sole choice and nobody else's decision. We want to talk about menopause, fertility issues, safe sex practices, sex from a woman's perspective, basically how sex can be pleasurable to women, as opposed to just looking at male ejaculation as the end goal of a sexual encounter. And also, of course, the cancers that primarily affect women, like breast cancer, cervical cancer, ovarian cancer. So all these issues, child marriage, these are all the things that we want to highlight.
Of course, moving ahead, we want to understand a little bit better about the long-term planning of not just OVA, but CodeBlue as well. Maybe Su-Lyn can pick this up. The endemicity of COVID-19 that is not, I guess, somewhat going to plan, but somewhat not going to plan. The reopening of borders, for instance, is still much debated. Booster rates are still quite low. We're hovering about 50% when it comes to adults, and of course, teens have yet to be rolled out. There's still a lot of pending issues when it comes to healthcare, not just about women's healthcare, but healthcare per se. What is it going to be like when it comes to covering health news, not just women, but general health news for 2022? What would be some of the areas that you think you're going to be focusing on for this year?
Actually, Ibrahim, our booster program has progressed quite well. I mean, as of today, about 64% of adults have already received their booster. So that's almost 2/3 of the adult population, which I think is pretty good. I would oppose I will oppose the government's plan to remove fully vaccinated status from senior citizens and Sinovac recipients who don't get their booster, because I don't think it's very fair to lump them together with the completely unvaccinated as if they're the same group. So if you look at it population-wide, I think we're pretty good. Our booster coverage is rather good. As to what other health issues may come up this year as COVID becomes endemic, there's the things like the tobacco bill, which is a short-term, I think it's a short-term concern because the Health Minister, Khairi Jamaluddin, did tell Parliament that the bill is still going through stakeholder engagement. He wants to table it at the Parliament Select Committee first, so it could be tabled in Parliament in the current Parliament meeting, but it looks like it's more likely to be postponed to the next meeting. So that itself is pretty groundbreaking, trying to ban cigarettes and tobacco products for an entire generation, for those born from 2005 onwards. So tobacco, smoking, and the associated diseases like lung cancer, that will be one focus. NCDs are another huge topic as well. So during the past 2 years, screenings dropped, treatment follow-up visits to doctors and treatment for chronic diseases also declined. So with COVID becoming endemic, so that should return. So more people should be going back to getting treated and screened for chronic diseases like diabetes, high blood pressure. So those are all very crucial. It's not, we shouldn't accept something like diabetes as a normal part of life. I mean, in developed countries like South Korea, for example, diabetes is a really serious issue. But for some reason in Malaysia, we're kind of okay with it, and we shouldn't be. I mean, I think one of the reasons why we had such high COVID mortality in the past 2 years, even though our vaccination coverage is very, very, very high. I mean, we're among the most vaccinated countries in the world, but a lot of people still died from COVID in Malaysia. I mean, we have the highest per capita COVID mortality rates in East Asia and ASEAN. And I think this is because a lot of our population is just in a generally very unhealthy state of being. So we need to look at that again. Once COVID is less important, we need to refocus our attention and the nation's attention on chronic diseases and how to improve people's health behaviors and how to make them health literate. A large number of our population is not health literate. So again, that ties into why COVID SOPs, for example, they may not be followed as consistently as they should. I mean, you can't blame the people because, well, first off, COVID is a very difficult disease to understand even for scientists because science keeps changing. We learn more things about it every day, but the general Malaysian population just isn't very health literate. So that's something that we need to look at for the rest of the year.
Najua, maybe one or two things that Ova is going to be focusing on for the rest of the year, maybe outside of COVID.
Okay, like me personally, also, it just occurred to me. I did think about some things that I would also like to cover in OVA. I think also aside from the diseases that are like cancer that get a lot of coverage, I think it would also I would also like to look at things like rare diseases, um, uh, mental health among women, even things like chronic fatigue syndrome, which I don't think gets enough coverage here in Malaysia. So hopefully there will be an opportunity to look at those health issues that are not as mainstream, but at the same time also, of course, we would continue to cover timely issues and issues, evergreen issues like breast cancer, cervical cancer, and I also hope to go more in depth into reproductive health, looking at we have a piece coming up on a lack of access to abortion and contraception. So hopefully that will provoke discussion among doctors and policymakers. So yeah, so those are the issues at the top of my head that I think we would like to cover in OVA in the coming year.
Right. Thank you, Su-Lyn. That was Boo Su-Lyn, Ova Founder and CodeBlue Editor-in-chief. Earlier on, you heard from Najua Ismail, the Ova Assistant News Director. You can learn more about Ova at ova.garlandcenter.org. There are plenty of resources for you to read there. They also cover a little bit of politics as well. It's also quite interesting slant onto how politics is affecting women's health and women's representation in our national ecosystem of representative voice. You can also find out more about IWD at internationalwomensday.com. Again, a lot of information about IWD 2022 and this year's theme called #BreakTheBias. Here at Astro AWANI, we support women issues and women rights, and we are, of course, a strong supporter of International Women's Day. Find out all the resources that you can get your hands on astroawani.com. Till then, thanks very much for watching, and goodbye.